Okay, so class 3 antiarrhythmics are really all about inhibition of potassium channels, specifically this delayed rectifier potassium current. Now this might sound familiar because we just talked about this in the last video. Now this is the current that gets inhibited if a patient has torsades. I told you just a minute ago that class 1A antiarrhythmics, because they can increase the QT interval, right? These medications are also medications that can potentially cause torsades, right? Medications like quinidine, procainamide, and now we can also see that class 3 antiarrhythmics can do that as well. And you might be saying, okay, well, why can they both cause it? Don't they have a different mechanism of action? Not quite. Class 1A antiarrhythmics, remember, they inhibit sodium channels, but they also inhibit potassium channels. So you're seeing a trend now. If I inhibit potassium channels, I can get a prolonged QT. And this is exactly what happens in congenital long QT syndrome, Romano-Ward, Dravet-Lange-Nielsen, or if I give patient, a macrolide, for example, and they have an underlying predisposition to getting this QT, or if I give them multiple medications that can prolong the QT, it's all the same concept. It has to do with these delayed rectifier potassium current channels. And at this point, I think this should make some sense, right? If I delay that part of the signal, right? If I delay my repolarization phase, I'm taking more time to go from phase 0 to the end of phase 3, and that is my QT interval. Okay, so that's where this all comes from. So QT prolongation puts the patient at risk for torsades, which is a polymorphic ventricular tachycardia. So remember, it's going to have all different shapes, right? Whereas a monomorphic ventricular tachycardia will look the same. Okay, so that's the difference also between torsades. Torsades, remember, magnesium is usually the treatment that's tested for torsades. Now, sotalol also prolongs the PR interval. Just to make things simple here, why does sotalol prolong the PR interval? Well, look at the end of the name. What is sotalol? It's a beta blocker, right? What do beta blockers do? They act really well, we just said, at the AV node, right? I already showed you this before. If I delay phase 4, phase 0 here, it's going to look something more like this, right? So it's going to take longer to get that depolarization through the AV node. That's going to prolong the PR interval. Okay, so that's what beta blockers do. So we have some beta blocker property and we have some class 3 property. So we can get potentially QT prolongation and we can prolong the PR interval. Okay, note that ibutylide and dofetilide, these other two on here, they do not prolong the PR interval. Why? Because they're not beta blocker. Now, you might be saying, isn't there a really big drug that we're missing that you didn't talk about in class 3? And yeah, absolutely. There is a very important drug you have to know a lot about. That is amiodarone. Okay, so amiodarone has class 3 properties. So why didn't I include it here? Well, it's because it has properties pretty much with almost all of these different antiarrhythmics, and it can actually get pretty overwhelming in terms of all the things amiodarone can do and all the side effects that it can cause. So we're just going to give it its own slide here in a minute.